I'm Federico de Armas. I was born in Uruguay like 51 years ago. I'm a dentist. I'm actually living in Mexico. My wife, she's Lorena. We have Martina, she's 10. I have this treatment here at UCLA because back in 2005, I have this mole taken from my back and it ended up in melanoma. Then I had this lymph node on my right side. When they tell you that you have this metastasis in your body, it's really hard to face. That was really tough, to tell my little daughter that.
Federico contacted me when he developed a metastatic melanoma. His melanoma had spread to his eye, to his bones, adrenal gland, lymph nodes in multiple places. Him and his wife wrote to me and said, they don't give us any option here. Do you have any clinical trial or any treatment option? And at that time, we also know that his melanoma expresses a marker called BRAF, which is what drives the cancer to grow. So we're starting a phase 1 clinical trial where we're putting together inhibitors of this BRAF with immunotherapy for cancer.
It was a clinical trial open. We started the treatment like in January 2016.
Federico went with this. He had to come every 2 weeks from Mexico. In March of 2020, when we had the lockdown from the global pandemic from COVID-19, the disruption to somebody who was on a clinical trial was enormous.
It did affect me because during the lockdown, at the beginning there was no flights. There were no flights at all. I had this metastasis in my brain. So yeah, medically it really affected me.
For 5 months, he was not able to come and continue on the clinical trial. But shortly after, things started to improve. We went from doing it all in person to be able to do video visits and ship drug to him. His melanoma improved and kept improving. So it was very encouraging to have him on this clinical trial that was giving him demonstrable benefit.
Infusion started. I have like 30 minutes for the, let's say, medicine to get into my blood. And yeah, it's magical because, it works. My diagnosis was, oh man, back in Mexico, you have 6 months, so you better start arranging things, And here it's my 6th year, so I'm really glad to be here trying this drug and to help other people.
We had to change very quickly. We had to embrace telemedicine. We had to allow remote consenting. We had to allow sending drugs to patients. We had to allow them to get their safety laboratory draws in a local laboratory, not have to travel to a referral center to be able to do them in a clinical trial site. Now that we see we could do differently, we're able to open up more and hopefully make clinical trials accessible to more patients in the near future.
I know UCLA, it's really interesting how they can manage, solutions for everybody. I don't have any words to tell my appreciation for them, for all the team. Here they treat me like a family member.